So the topic today we are about to start, that is the clavicle. As we know, this clavicle is having a different names too. I am holding the clavicle in front of you. I am just holding the clavicle in front of you, and this is how the clavicle looks like. This is the clavicle bone, and this bone is having few another names. The time you will write in the exam, you can write the different names of the clavicle. This bone is having another name of beauty bone. This bone also called as a collar bone. So this is the two names. One is the beauty bone and the second one is the collar bone. Why this name is given? As I told prior in the few other classes, that the reason why it is called as a beauty bone, because the more you thin, people think that's the fashionable idea, that's the reason this clavicle is to pop out. That's the reason it's called as a beauty bone. Why it is called as a collar bone? The reason is it's present near the third collar. That is the reason this bone it is called as a collar bone. So this is the two reason why this clavicle is having a two names. One is the beauty bone and the collar bone. That is the another names. Now if you see the skeleton, we can see this clavicle, it's there on both the sides of our body. This clavicle, it's present on the right side, it's present on the left side too. In between, we are having a bone, that is the sternum, and this clavicle, it is attached medially. This is the medial portion, this is the lateral portion. Medially, it is attached with the sternum, and laterally, if you see towards the lateral side, and laterally, it is attached with the acromion process of scapula. And that is what is the attachment of the clavicle. That means this clavicle bone, it is attached towards the medial side with the bone which is named as sternum, and towards the lateral side with a bone that is a part of the scapula, that is the acromion process. And that is how both laterally and medially the clavicle is attached. And in these two regions, the clavicle makes two joints. When medially the clavicle it is attached to the sternum, this portion, medially when the clavicle attached to the sternum, this is called as sternoclavicular joint. So listen the joint name properly. It is sternoclavicular. Why the name is sternoclavicular? Because the attachment with the sternum with the clavicle. If you see laterally, the clavicle it is having a attachment with the acromion process of the scapula. And that's the reason this joint is called as acromioclavicular joint. So that is how the names are given: sternoclavicular and the acromioclavicular joint. This is the bone and this is the attachment of that particular bone. Now you need to understand the anatomical position, the first point what we read in the last class regarding the osteology, that is the anatomical position. What is anatomical position? Anatomical position means I am holding this bone like this. I may hold this bone in this position. I may hold this bone in this position. If you see this bone properly, where exactly the attachment of the clavicle? So I will show you this another small model. This is not the original bone. This is the PVC model. This is the bone. This is the lateral side where the clavicle is attached with the acromion process. This is the medial side where the clavicle supposed to attach with another bone, that is the sternum. Now, what is the anatomical position? That means how I will hold the bone. Which is the anterior aspect? Which is the posterior aspect? Which is the superior surface? Which is the inferior surface? So to understand that which is superior, which is inferior, and which is anterior, which is posterior, understanding that, that's what it's called as anatomical position. Now, there are few points to understand. First, you need to understand that which is the medial surface. এই যে বোনটা, আমি দেখো বোনটা ধরে আছি. For this particular bone, which part is towards the medial? Which part is towards the lateral? That means for this particular bone, which part it is attached with the acromion process? Which part it is attached towards the sternum? Remember, the sternal end, that means the part which is towards the sternum, that means towards the medial side, it is quite broad and large. This is the first point of understanding the anatomical position. The clavicle, it is having a two end. One end, it is towards the medial side, that means towards the sternum. If I place this bone, one end, it will be towards the sternum, and another end, that will be towards the acromion process. Remember, this bone, this sternal end, this surface, it is quite broad and enlarged and rounded in shape. দেখো জিনিসটা কেমন দেখতে? This is rounded in shape. But if you see the acromion end, it is quite flat and elevated. It is rounded and it is flat and elevated. So this flat and elevated part, it is towards the acromion process, and that is the reason why this end is called as a lateral end. মানে এই যে side, this side, it is the lateral end, and this is the side why this projection, it is the medial end. This is the first identification points of the anatomical landmark. Now remember that this end, medial end, always supposed to be towards the sternum, and the lateral end, it always supposed to be towards the acromion process. So I will hold this bone in this position so that this side supposed to be towards the sternum and this side supposed to be towards the acromion process. Clear for all? Okay.
Yes, sir.
Yes, sir.
Now the most important things will come. এবার সবচেয়ে মজার একটা জিনিস আসতে চলেছে. See, I am holding this bone like this. Now I may hold this bone in this way. I may hold this bone in this position. For both, this is the medial and this is the lateral. I may hold this bone in this way. I may hold this bone in this way. Which is the proper anterior surface and which is the proper posterior surface? To understand this, which is the anterior and which is the posterior. First, what you will do, you will take your thumb and you will drag your thumb over the clavicle. You just need to drag, you need to just make the movement of the thumb over the clavicle. You will see towards the medial side it's elevated, but the time it will go towards the lateral side, it is having a depression. Once more I will repeat. If you take your thumb and you will move the thumb from the sternum, you will move your thumb from the sternum towards the acromion process, you will see towards the sternal end or the medial end, it is elevated, which surface is called as a convex surface, because it is elevated. And if we will see towards the lateral side or the acromion end, we will see it is having a depression, which is called as a concave surface. So this is the concave surface. So from this, what point we understood? We understood that if I hold this bone in this position, and if this is my clavicle, the medial end or the sternal end on the anterior surface supposed to have a convex, and towards the lateral end, the anterior surface supposed to have a concave. So this is the anatomical position of this bone. Remember, the bone, it is bit of downward tilted. Downward tilted means the bone is not straight, the bone is like this. So this is how the anatomical position of the bone, and this is how you need to hold the bone. Holding the bone in the anatomical position, like examiners will tell you, hold the bone in the anatomical position, you will be confused. Sir, how to hold the bone in the anatomical position? This is the anatomical position of holding a bone. Where the medial end will have a anterior convexity, which is elevated, and the lateral end will have a anterior concavity. So this is the anatomical first point to understand. This is the anatomical position. Now, another way we can understand, which is the medial end and the lateral end. Towards the lateral end, there is a inferior area. In this inferior region, there is a rough surface. By this also, we can understand the anatomical position of this bone. So this is the 2 point how we will understand the anatomical position of the bone. Now the more important things is going to come. Let me see who are quite listening this class properly. Ke shunche class take properly. Now the point comes, which side the bone is. I am holding the bone in the right side, or I am holding the bone of the left side, and that's understanding is the most interesting. Wait, don't give the answer. And that's going to be the most interesting, because the examiner will tell you, pick up the bone. You will pick up in confidence, and after that the examiner suddenly will ask you, which side is the bone? You will be skulking. Right side or left side? Right side or left side? Say right, left. So don't give like the answer right, left. So you need to tell which side is the bone is. That means this clavicle is of my right side, or this clavicle is of my left side. Even then, to understand this, first don't give the answer. First try to understand. First I will hold the bone in the anatomical position. I am not holding the bone in the right hand or the left hand. I am holding the bone in the anatomical position, and I know this is the anatomical position because towards the medial end, anterior there is a convexity because it is elevated. Towards the lateral end, Anterior, it is concavity because it is having the depression. Because that's the reason I will hold this bone in this position. This is the anatomical position. But I don't know, does this bone it is the right side or the bone it is in the left side. Now I will place this bone. Now I will place this bone on both the sides. I mean, দুটো সাইডে বোনটা রাখছি, and you people have to tell me the right answer. First, I will hold this bone. This is the anatomical position. I cannot do anything. I have to hold this bone. I cannot hold the bone like this. I cannot hold the bone like this. This is the anatomical position. And as I know, this is supposed to be the medial end because it is rounded ellipse, and this is the enlarged and flat. Now I am holding the bone towards the right side. Again, I am holding the bone towards my left side. Now can anyone give the answer? Which side is this?
It's a left, sir.
Left side.
Shall I lock the answer?
Left side.
Yes, sir.
Yes, sir.
Yes, sir. Left
একটু
side.
বন্ধ করে।
Yes, sir.
Any
Yes, sir.
lifeline anyone want to take? Any phone call? Or else I
Yes,
lock
sir.
the answer. So চোখ বন্ধ করে, the answer is, it is the left side. There is no reason only, there is no point only to tell that this is the right side bone, because if I hold this right side bone with simple calculation, that end is going to change. And this is, as I told, the sternal end. That suppose it's going that side, so no, this is the wrong side. I am holding the left side. Now in the exam, the time you will, these timings you will take 1 to 2 seconds, because by that time you will be ready for your answer. And that's the time what you will do, we'll just pick up, and the time you will understand this is the left side bone, you will hold the bone in the left hand. And you will place the bone accordingly. You will be showing the examiner that in which side and where area the clavicle is. So you will be locating this bone like this. And by your right hand, you will be telling this is this end, this is this end, this is the surface, this is the lens, this is the bony region, this is the muscular surface, like that. So again, this is very crucial how you will hold the bone in the exam. This is very crucial, the time you will hold the bone in front of the examiner. Now I am holding this bone in my left hand because I ensured that this is the left side. And this is the anterior, this is the posterior, this is the superior, and this is the inferior surface of this bone. Now the third point of the osteology. What was that? What is the third point of the osteology? Anyone from the class?
Ossification centers.
Very good. That's the ossification centers. Remember, this is such a bone. It is having, remember, this is such a bone which is having first bone to start the ossification and last bone to end up the ossification. আবার বলছি, I will repeat once more that this is the bone, or this is the first bone to start the ossification. This is the first bone to start the ossification. So if I hold these so many bones in, I am holding the humerus, I am holding the scapula, I am holding the clavicle. Among all of them, this is the first bone. This is the first to start the ossification, and this is the last bone to end the ossification. That means in the intrauterine life. What do you mean by intrauterine life? Anyone knows? Anyone familiar with this word? What do you mean by intrauterine life?
When the embryo is in the uterus, the development phase is known as intrauterine life.
Very good answer. When the baby is in a uterus, and that's the developmental phase. That in this part, this area is called as a intrauterine life. This bone is the first bone to have a ossification within the age of 5th to 6th or 5th to 7th. Some books it's written 5th to 6th or some books it's written 5th to 7th weeks of intrauterine life. That means this is the bone, and this bone in comparison with the other bones will start its ossification within the age of 5th to 6th or 7th weeks of intrauterine life. That is the primary ossification starts. And this bone will end its ossification at the age of 21 years. Those who are not yet for them there is a chance of having the clavicle to get enlarged. যারা এখনো টাচ করোনি 21, so yet there is a chance of having a enlarged clavicle. And that is the end of this bone, and that's what it is called in your whole body. This is the last bone to end up with the ossifications, and this is the first bone to start up with the ossifications, and it varies from each bone of your body. And that is what is the ossifications. So what is the ossification for the clavicle? It is the 5th to 6th or 7th weeks of the intrauterine life, and the ossification ends with the 21 years of age. So that is the whole of the ossification. So today we read 3 important parts with the basics of the clavicle with the another names and the attachment. That is, first we read the another names of the clavicle, then we read the attachment of the clavicle and the joints surrounding it, then we read the anatomical position, then we read the side determination, and now we read the ossification. So that is the end of today's class, and the next week we will be reading the surface and the bony landmarks and the muscle attachment for the clavicle.
Sir, একটা question.
So we will go very small area so that it will be easy for everyone to recall